If you were to ask me in 2019 what would be the next big viral pandemic, I would have said bird flu.
Davey Smith is chief of infectious disease at UC San Diego Health. He says virologists have been watching bird flu for years.
Right now, we have a virus that is circulating in cows and in birds, but it's not circulating in humans. So, what is that virus going to look like when it finally does get to us? Is the question.
Newsom's state of emergency means state agencies will work together to educate farm workers and employers about prevention and the use of protective gear. And they're planning bilingual outreach events to educate the public on how to stay safe.
Starts getting the infrastructure and resources in place for our public health agencies to start testing or to increase their testing, increase their education, increase the preparation for getting ready if bird flu were to erupt in a big way.
Scripps research scientists in La Jolla have been studying how the virus evolves. They published a study earlier this month where they identified a mutation that could make it easier for it to spread among humans.
So that gives us a little bit of a crystal ball of saying, hey, these are proteins that are really important that perhaps we need to include in our vaccine so that when the virus has evolved to infect us from person to person to person, this might be a really good strategy to block that.
Smith says besides direct contact with farm animals and wild birds, the virus can spread in raw milk, so avoid it and drink pasteurized milk instead.
I am not freaking out. I am still going to have my latte.
He says while the risk of bird flu remains low for the general public, Newsom's declaration will help public health departments be ready to sound the alarm.
Hopefully early enough and ready enough so that when we know what vaccine to give, that we can all get it and be protected as much as possible.
Heidi de Marco, KPBS News.